Orlando, the city beautiful, home to Mickey Mouse, the UCF Knights, and the Lake Eola Swans. But behind all of its beauty is a city still struggling with food insecurity, lack of mental health care, and lack of access to health care. Three of the areas needing immediate attention, as noted by the 2019 Central Florida Community Health Needs Assessment by Orlando Health, Advent Health, and more. Orlando is ranked number 2 for new HIV cases in the nation, and many remain uninsured or underinsured. Today, I'm going to take you on a tour around town to show you what the community is offering to improve healthcare within our city. From free clinics such as Shepherd's Hope to incredible local representatives constantly advocating for improved healthcare with our best interest in mind, Orlando remains the city beautiful.
Hi everyone, so it is about 6 o'clock on a Tuesday and I am about to volunteer at Shepherd's Hope. So usually I volunteer once a month as a medical scribe. We have different specialties each night as well as primary care every night. And I am placed with a physician or a nurse practitioner and I serve as their scribe for the night. What I like most about Shepherd's Hope, especially my location in downtown Orlando, is that each volunteer comes to serve a similar purpose, and that is to expand healthcare within our community. We have students from our local university come after their long days in classes to volunteer at night. We have physicians, nurses, medical scribes such as me who come straight from their day jobs to continue working in order to provide health care for those individuals who need it the most in our community. I think it's just really great that I'm surrounded by a bunch of like-minded individuals who love their community just as much as I do and want everyone to be able to access health care that they so greatly need. So let's go in and speak with Gloria and Muhammed and learn more about Shepherd's Hope.
My name is Muhammed. I'm the Health Information Management Coordinator at the downtown Shepherd's Hope location. My job is basically a glorified computer geek. I handle anytime anyone has questions about how the EMR works or how we're supposed to input orders or input patient appointments, edit information, delete information. That's all pretty much my domain. I'm supposed to handle any medical records being inputted into the system, scanning documents, and then basically also delegating a bunch of work to volunteers.
My name is Gloria Alvarez. I'm the health center manager for the downtown clinic. My main role is to run the clinic every night, making sure that we have enough volunteers to run it and bring the patients in and have them ready for the doctors.
Yep, and tonight just goes to show that we are all completely volunteer ran for providers and office staff. We had no nurses or medical assistants tonight, so you were doing all of that as well as your normal
yes.
job.
Well, we have to do what we have to do to make it
Yes,
happen.
volunteers are very important here.
Well, people that are underinsured and uninsured that are under the 200% poverty level. I don't have the exact numbers, but I know over the 22 years that we've been open, we've seen, I think it's over 25,000
Wow.
patients. A very young guy who came here with heart issues. Actually, they were congenital, and he was the last one of his family alive.
Oh, wow.
And he came the night that the cardiology was here, and somehow he made it happen. He got a defibrillator from the doctor. He was able to get that done, but that wasn't enough for him because with that he got a little better, but within a year he got bad again, and he did a heart transplant.
Wow.
And they were able to do it.
Wow, all free?
It was all free.
Wow, that's amazing. And another cool thing, I guess, that happened today is a patient with family history of breast cancer A lot of times people with insurance or with, financial stability, they want to check for the BRCA gene, and we do that here for free or for a
Well, it gets donated
donated,
through our partners.
which is otherwise a very expensive test. So that's very cool. Well, thank you guys. Okay, so I am here with Dr. Pacheco. He is an endocrinologist here in Central Florida. He also volunteers at Shepherd's Hope, the free clinic in downtown Orlando. And I just wanted to ask you, since you see patients there who are uninsured or underinsured, as well as patients here who, maybe do have insurance or the means to pay out of pocket, what the difference is in their diabetes control, and if there's any difference at all in respect to maybe their health literacy or a lack of resources due to being uninsured or underinsured.
Yeah, it's quite interesting because diabetes is quite a complex disease, and in recent years there's been new development of new medications, insulins, diagnostic sensors, and certainly even though they're very good, patients who lack resources are not able to obtain these newer insulins and newer glucose monitoring devices to control the diabetes. So it's certainly there is because of the lack of resources, there's lack of utilization, and therefore there's worse control in patients who are underinsured. Also, what's important is that people who lack resources or lack of literacy, who don't have a good support at home, are not able to. We cannot train family members to help them control the diabetes just because they're not available. Many times, people who have lack of resources, their family, everyone works at home, therefore they come by themselves and they just are not able to provide the support that would be helpful.
So going off what Dr. Pacheco was saying about his patients at his private practice versus his patients at the free clinic, what I have observed is our patients at our office have so many resources, including a nutritionist, a diabetic educator, the glucose sensors and insulin pumps that Dr. Pacheco mentioned, whereas it is so much harder for our patients at Shepherd's Hope to access these resources. We do provide many, many, many different resources through Shepherd's Hope, including acupuncture even, but we can't provide all of that care. We don't have a nutritionist as far as I am aware, or a diabetic educator. So these patients are at a huge disadvantage in controlling their diabetes compared to the patients at the private practice who have these multiple resources. It's very sad to think that our current healthcare system is not conducive in controlling a disease like diabetes for many people. So I'm very grateful that our community has resources available such as Shepherd's Hope to those individuals who need those resources. Although taking into account the 2019 Central Florida Healthcare Needs Assessment Report, Shepherd's Hope alone and the other free clinics within our community is not enough, and that's just the unfortunate truth. So I'm going to go ahead and call up Representative Anna Eskamani and kind of pick her brain and see why those resources aren't enough for our community and what we can do to improve that. So I am on the phone with Florida Representative Eskamani. Why don't you go ahead and introduce yourself to the listeners?
Sure. So I am a State House Representative serving the Great People District 47, which includes Orlando, the downtown area of Orlando, Winter Park, and Belle Isle. And I was elected in 2018, so I'm serving my first 2 years in office.
And she's doing amazing.
Thank you.
So I was looking at the 2019 Central Florida Health Needs Assessment that was put together between, I think, Advent Health, Orlando Health, Orange Blossom Family Health, just to name a few. And as I was looking through it,
I noticed a few things. I guess it didn't shock me, but it left me a little shocked. As I was reading through it, they pinpointed 3 areas that need immediate attention. Those are food insecurity, access to mental health care, and access to general health care. Another thing that shocked me was that Orlando is now ranked number 2 for new HIV cases. And I guess I was kind of shocked about this just because I've been in Orlando for 4.5 years now, and I've just seen the great sources we have within our community for access to care. We have, Shepherd's Hope, Orange Blossom Family Health, Primary Care Access Network. For mental health, we have the Mental Health Association of Central Florida. For LGBTQ plus health, we have the Center, Hope and Health, as well as, I forgot this, we have Florida's largest university in our backyard, who I'm sure is a great source of service within our community. So I guess I wanted to ask you, what do you think is the reason we are in this current state of lack of access to healthcare right now? Is it transportation? Is it lack of awareness to these sources? Or is it legislation itself? I just wanted to hear your thoughts.
This is such a great question. And it's the foundation of all the problems that we need to solve in this great state. And the reality is that there's not one answer to it, right? So I'll try to unpack as much as I can from at least the perspective as a Orlando native and as a lawmaker too. I think you hit the nail on the head when you talked about some of the other barriers to care. So I think you're right. I mean, Central Florida and so many communities across our country are home to amazing nonprofits who are doing their best to meet the need. But the reality is that we don't have enough charity care resources. We've never expanded Medicaid in Florida.
Yep.
So, for many, they don't have access because they can't afford health insurance, or they make a little too much qualify for Medicaid, sort of the coverage gap. And that puts them in a place of navigating, do I buy food this week or do I go to the doctor? And so many Floridians, especially Central Floridians, will actually delay access to care, turning acute problems into chronic problems, which then become much more expensive and difficult to manage. So we see that a lot. And even our nonprofits that do amazing work, they have wait lists. They have lines outside their health centers. Folks sometimes wait hours to get an appointment. And so that also can be impossible if you're a working mom, if you are using one car as a family. There's so many other elements there. And it goes back to what we often call in social health spaces the social determinants of health. And so, it's not just about, is there a health center there? It's also about how do I get there? Is there care in my language? If you're undocumented, you might be fearful to go to a doctor because of a deportation, or if you face other types of disabilities, then you might be less inclined to go to a doctor because you might feel judged or shamed, or the same can be said for folks who are LGBTQ+. So there's also the need for cultural competent care, and also looking at a person's environment, and whether it's transit or air quality or water quality. There's so many other, unfortunately, location issues that not just impact your physical access, but also your physical health and your mental health. There's a lot of research out there around grounded in something called social disorganization theory, which really just emphasizes that location matters. And when you're looking at a map, you can almost determine the likely health outcomes of communities based on where people live, because of some of the variables I just listed. And ultimately, I think one of the biggest needs is funding. And I mentioned Medicaid expansion, which is federal dollars. The state of Florida has continued to decline, which is put us in the place we are today with about 800,000 Floridians estimated that don't have access to any type of coverage for health insurance. And then there's also just a lack of funding and programs in general. So whether it's mental health, where Florida ranks the bottom of, whether it's issues around primary care, individuals with disabilities. Florida's wait list is 21,000 people right now. And that's grounded in how Florida funds itself, and we're a very heavy sales tax reliant state, and we rarely have enough money to pay for everything. And actually, Florida's healthcare system, our state healthcare system, is very much grounded on fee for service. What I mean by that is we charge folks, and it can be a small charge, but there's almost some sort of payment when you're accessing services. And even this past session, there were there were many healthcare bills passed, but 3 that were passed that included a fee. And one of them, for example, was telehealth. So Florida, created a telehealth system, and there was a very small fee that out-of-state doctors who want to register with the program would pay, about $150. And that fee was going to pay for the program. Well, the governor vetoed the fee bill. He signed the policy bill into law, but he vetoed the fee bill, which means there's, at this point, DOH, Department of Health, is going to have to look for a new source of funding to pay for the management of that program. And that's unfortunately too common, where we have unfunded mandates, we have excellent programs that are underfunded, understaffed, and that's going to impact a person's ability to be seen by a provider and to live a happy, healthy life.
Yeah, and that was my next question about how Florida not expanding Medicaid has impacted us, and obviously it's not doing any good. So I guess my second question is, do you want to talk about any bills you have sponsored or co-sponsored pertaining to healthcare-related issues facing Florida, such as the opioid epidemic, HIV, access to care?
Yeah, I'd love to talk about that. So, we are very engaged in mental health legislation. We're engaged in opioid reduction legislation, HIV legislation. We're pushing for more funding into these avenues, funding to reduce the wait list for individual disabilities, for example. Some bills specifically lift up. So we're actively having conversations with the budget chairman around mental health, and just not just member requests for different nonprofits, but the overall system needing additional funding so that we can ensure our youth have access to counselors and alongside adults. We have a huge incarceration problem in Florida, and so many folks who are incarcerated are there because of a mental health challenge that was never addressed. And if we can put money in the front of this and help folks get the care they need, then we can help prevent incarceration rates, which becomes much more expensive too to have folks in our prison system. We're also sponsors of efforts to decriminalize HIV in Florida. Florida has some really archaic HIV laws that, even when HIV is not transferable, detectable, in the sense that an individual is engaged in their medical regimen, they're very healthy, living with HIV, they can still be criminalized for sexual activity, and it doesn't make sense anymore. There are archaic laws that also severely punish people of color more than others because they live with HIV. So there are efforts to decriminalize HIV and really keep it in the public health sector versus put people into a place of harsher punishment for living with HIV. We also have absolutely supported Medicaid expansion. I've been a firm advocate for Medicaid expansion ever since the debate started back in 2013 in the Florida legislature, and unfortunately, time and time again, nothing moves. Today's legislative leadership is very anti-Medicaid expansion, so we continue to do our best to advocate for it and to emphasize why it would save money, why it would allow people to access preventive care, and it's the smart thing to do. And then, on another mental health issue we've been fighting for and really talking about a lot is Baker Act. Florida has a really, I mentioned already, severely underfunded mental health system, but Baker Act in particular has just attracted really terrible, scary situations and stories from families. And we had a local family whose daughter went through the Baker Act experience and was placed in a room with adults. Just really bad bedside manner and an experience that can cause more trauma for a young person that the intervention is supposed to serve. And so it definitely seems like the Baker Act is just underfunded and putting people, especially youth, at risk. but B, overused. And now there's a conversation, especially in the school setting, of teaching teachers, teaching RSOs, counselors, the different degrees of support, and perhaps Baker Act doesn't make sense at that time. So we're diving into those type of issues as well.
That's very
so
important.
a lot of the work happening, and I'll say too that one of our biggest issues in the healthcare realm is prescription drugs. And last session, legislature passed an importation bill, but the importation bill for drugs from Canada is very, very focused on just state plans and state employees even, so it's not going to impact the greater population of Florida. And it's very slow moving. I mean, the federal government just approved the plan, and there's so much more to actually happen before it becomes reality. And meanwhile, prescription drugs continue to be very expensive for families. So we've been really beating the drum around accountability and transparency within the prescription pharmacy drug system. And our co-sponsors have a bill that really tries to tackle pharmacy billing managers, and I won't dive into it too much, but there are pharmacy billing managers, or PBMs, are basically middlemen between a pharmacist and their patient. And there's been, unfortunately, a lot of manipulation of just that middleman structure, where they're taking money from the transaction. So other states have passed transparency bills. The federal government's talking about it too. And we have filed a bill with our Republican colleagues, actually, and it's bipartisan. And we're pushing for some movement on it, and are hopeful to at least see that bill get some traction this session.
Awesome. A lot going on right now.
Yeah, definitely.
I guess my last question is, what can we, the people of Orlando, do from a political or advocacy standpoint in improving healthcare in our community?
It's a really great question. My first thought is that you got to get engaged. And so get to know your state lawmakers. There's a lot of attention on Washington, D.C., which is important and necessary, but don't forget what's happening in Tallahassee. There are, so many regulations and decisions come out of this building. And it's really important that advocates are engaged in the process and watching as things move forward. And you can get in touch with your lawmaker, through social media. You can meet with us in person, call us, write to us. I do my best to read every message that comes my way. So it's really important to, as proactive as you can be, to engage in that way. And there's no level of engagement that's too small.
Yeah.
Everything really matters. And then from the perspective of a lawmaker to the medical community. So many of our advocates in the medical community are part of associations, and that's fantastic. But I do think that when you're coming with an association, in a lot of cases, that association is going to have their legislative priorities. And you might 100% align with those, but I definitely encourage folks to go beyond what associations focus on, because at the end of the day, we're talking about intersectional issues from an intersectional lens. A lot of the debate in Tallahassee in the realm of medicine is grounded in things called scope of practice. And so it's all about, it's basically like, debates between different types of providers of who should do what. And obviously every state has their standards and regulations, every country has their regulations, but it becomes like a really intense debate, and it's kind of over basically various opinions. And we try to be as fact-based as possible about, who's qualified to do what, and really emphasize patient safety above all. But, at the end of the day, those debates, they don't necessarily capture the problems you and I just talked about.
Yep.
Whether it's, being able to access care because of transportation, or living in a community of clean air, having parks you can get exercise in. Like, there's so many other social determinants of health issues out there that in so many cases they get forgotten in the middle of these, kind of intense debates about scope of practice. And again, those debates are valued and important, and we're honored to be a part of it. But I never want to lose sight of the fact that the average person does not really care about this fight, right? Like, if you're in the profession, you do. But, like, if you're someone who is just trying to access to healthcare, you want a qualified, affordable individual in front of you. And And, we have to make sure that no matter what the debate is here, that at the end of the day, that's what happens. So that person has access to a qualified healthcare professional, based on standards that we establish with medical guidelines in mind. And let's not lose sight of what else does it take for that to happen? Is it Medicaid expansion? Is it, access issues? Is it medical students? Is it helping more people go into medicine and nursing? Is it, having outreach opportunities so that more people of color go into these fields? Like, there's so many other, areas of focus we could talk about, and I never want the conversation to get caught up in the the industry tension, and I want to make sure we always center on the people who are impacted.
Exactly. Well, thank you so much. This was very helpful. And I just wanted to wish you the best of luck with your PhD, with the legislative session, and just thank you for taking the time out of your busy schedule to speak with me, and hopefully this video will maybe make its way through the community and give some insight to Orlando. Well, that's a wrap. Thank you so much to everyone who participated in this video. Thank you to everyone who will end up watching this video. I hope I provided you all with some good information, and I will be providing even more information below on resources within our community. Thank you.